Hello, I'm Azlina. I'm from ME123. I'm also one of the part-time staff at IME Library. Today, I'll be reviewing this ebook, Lecture Notes, Orthopedics and Fractures. And there's this short description about this ebook, and then these are the table of contents. It is divided into two parts, part one and part two. Part one is the general principle, part two is the original orthopedics. If you click here, it will lead you to this page where you can go through this book. The ebook covers essential orthopedic principles and fracture management strategies in a systematic manner. It begins with foundational topics such as anatomy, biomechanics, and pathology relevant to the orthopedics. Subsequent chapters delve into specific orthopedic conditions, including the musculoskeletal trauma, joint disorders, and the pediatric orthopedics. Each chapter provides a comprehensive overview of the condition, covering its etiology, clinical features, diagnostic methods, and the treatment options. The ebook also includes practical information on the orthopedic procedures, rehabilitation protocols, and common complications encountered in the orthopedic practice. If you ask me what I like about this book, these lecture notes, orthopedics and fractures stand out for its concise yet comprehensive approach to the orthopedic topics. The ebook present complex orthopedic concept in a clear and understandable manner, making it accessible for medical students and junior doctors. I appreciate how it covers a wide range of orthopedic conditions and fracture management strategies while maintaining a focus on a clinical relevance. The inclusion of clinical cases and practical scenarios enhances the learning experience, allowing readers to apply theoretically knowledge to the real world patient care situations. Additionally, these ebooks' user-friendly format and clear illustrations facilitate effective studying and comprehensions. This ebook is highly suitable for IME programs, particularly in orthopedics, trauma surgery, and mus- musculoskeletal medicine, and its comprehensive coverage and clinically oriented approach align well with the university's curriculum. So students from the clinical school, they find it very useful when they go for the orthopedic rotation. The ebook's emphasis on the practical implications and inclusion of clinical cases make it valuable for integrating theory with practice. While its concise format and clear illustrations cater to the educational needs of medical students, facilitating effective learning and retention of key concepts, it would definitely recommend this ebook to colleagues involved in orthopedic education and clinical training, as its comprehensive coverage, clinical relevance, and user-friendly format make it an invaluable resource for the enhancing orthopedic education. That's all from me for this session. Thank you so much.